The vestibular and ocular motor screening is used to identify impairments in the vestibular and ocular motor systems. It is designed for use with people aged 9 to 40. For each test described, symptom scores are recorded pre and post-test for headache, dizziness, nausea, and fogginess on a scale of 0 to 10. For each test, we are looking for normal eye movements. By this we mean smooth, steady eye movements that are coordinated between the left and right eye. Smooth pursuit is the ability to follow a slowly moving target. The athlete remains still whilst a single target, approximately 1 metre away, is moved 30 degrees to the left and the right of midline at a speed of 30 beats per minute. The test is repeated twice to each side and then repeated in the vertical direction, 30 degrees above and below midline. Saccades is the ability for eyes to move quickly between targets. The athlete keeps their head still and moves their eyes as quickly as possible between two targets that are approximately 1 metre away and 30 degrees to the left and right of midline. They perform the task 10 times to each side and then repeat this in a vertical direction, 30 degrees above and below midline. Convergence is the ability to view a near target without double vision. The athlete keeps their head still and focuses their gaze on a small target, 12 to 14 font size, held at arm's distance. They then slowly move the target towards their nose until double vision is experienced, or the examiner observes outward deviation of one or both eyes. The distance at which either of these occurs is measured to the tip of their nose in centimetres. The same target should be used for all testing to ensure reliability between testing events. Vestibular ocular reflex is the ability to stabilise vision as the head moves. The athlete maintains their gaze on a stable target, 12 to 14 font size, approximately 1 metre away, and moves their head 20 degrees to the left and right of the target, at a speed of 180 beats per minute. The task is repeated 10 times to each side, and then repeated in a vertical direction, 20 degrees above and below midline. The same target should be used for all testing to ensure reliability between testing events. Visual motion sensitivity is the ability to inhibit vestibular-induced eye movements using vision. The test is often started in sitting and progressed to standing if the athlete tolerates the seated test. The athlete stands with their feet shoulder width apart, arms outstretched and thumbs together to form a visual target. They maintain their gaze on their thumbs and rotate their head, eyes and trunk as a unit, 80 degrees to the right and left of midline, at a speed of 50 beats per minute. They repeat the task 5 times to each side. During the standing test, the examiner should stand close to the athlete in case they lose balance. This test can be done on wheelchair athletes in a seated position if their function allows. Abnormal findings can include irregular eye movements, those lacking smoothness or coordination, as well as any increase in symptoms that occur during or a couple of minutes following each test. These findings tell us that there is an impairment within the vestibular or ocular motor systems. We can use this information as a starting point for treatment and to shape the direction of our rehab program. There are some useful resources available on the AIS Concussion website that can help guide practitioners to create a rehab program and include examples of exercises to challenge and retrain the vestibular and ocular motor systems.